would have gotten. But of course, I know one of my students, a doctor in economics, is very happy when he sees those influences. Dr. Kato is very happy. But to me, knowing that early childhood education, those questions would have given you very good. What is the influence of school parent engagement? Period. What is the contribution of school child protection? Period. This one here, and you see, if I extend it further, it ended up creating 2 studies in your work. When you look at chapter 4, you have 2 studies. Probably, if you had presented the findings concurrently, you've said yourself that one complements the other. You give the quantitative and then you supplement it with the qualitative. But you gave the qualitative and then you supplemented it with the quantitative. That one. Geographical scope, we have talked about it. The time scope. Safina, what was your time scope?
2016 to 2023.
They are not hearing you. I'm not hearing you.
It was 2016 to 2023.
Yeah, don't you think that your time scope somewhere might have given you flimsy or constrained findings, given that you somehow carried out a study during an unprecedented time, during COVID, where there are many things which took place which might have been problematic, justifiable. Because the research itself, when I read your work, you carried it out during that period, the COVID period. Did it give you what you wanted? This one you may answer.
This timing, Professor, I appreciate you for that question. The timing I included under the time scope, I considered the time when the NIECD was put into place and that period in which I collected data. That was the timing I referred to within the time scope.
In your work, do you make a disclaimer to the effect that these findings are corrected, blah, 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 during a time of a crisis, so in your limitations, it could impede somewhere? Let us continue, process by process. How do you feel now? Safina?
Yes, Professor.
We continue? Take a sip. It is not fighting. It is an academic engagement. Let us get it a bit technical now. Chapter 2. Safina, not Safina. In the literature review, I only briefly look at the section of theoretical review, which I avoided intentionally in chapter 1. Why did you choose the social capital theory, which is mainly used by economists like me, and not any other?
Thank you very much, Professor, for that question. The reason that I chose the social capital theory is that that theory focuses at social relationships whereby individuals and groups focus at work working in collaboration to achieve a common goal. Since my study majorly focused on partnerships and relationships, collaborative interventions, it's the reason that I saw the social capital theory fit for the study. Since under Putnam, he also looks at it to support community engagement and public participation. That's the reason to why I use that theory.
If you are given another chance, which other theory would you add an alternative?
I would look at community engagement theory.
Okay, now, more technical. For theory, for objective, one, you talk of school parent engagement on good chance in your theories such as Piaget's theory of Jean Piaget's theory, Vygotsky, etc. of social learning, and we are talking of theoretical review. Did you?
I majorly looked at theories that promote partnerships, since I was looking at school community partnership on the zone of proximal development and the one of Piaget, but others I did not look at them into.
So you're looking at partnerships. So your objective number one is misplaced, because I see what is the influence of school parent engagement on early stimulation activities.
In that objective, Professor, I majorly focused at this.
Okay. Let us go to methodology. Are you clear? Safina, are you clear?
Fairly, Professor.
Okay. Methodology, briefly I'll ask, what was your study population?
My study population was, the general population was 348, but the sample size was 260.
Safina, what is the study population?
The study population was 260.
Safina, what is the difference between the parent population, the target, and accessible population?
The parent population is the overall.
That is what I'm asking. You are giving me something you have created. So when they ask you for the study population, they mean the entire Ugandan. Remember the question I asked you in the beginning, why do you have two titles? One says Kira municipality, the other one says Uganda. So because it is from the entire study population, which is the parent, that now you go for the target, which is Wachiso. And from the target, you go to the accessible, which is what? Kira. But that one you have to sort it out. We can leave all others, but that one sort it out, because it is technical. Now, what was your study design, Safina?
I used the cross-sectional survey design.
Safina, have you ever heard of a case study cross-sectional design?
I have ever heard of it, but
try to study it and put it in your work. The other question, what was your study or research philosophical orientation? Check in your work.
I beg your pardon, Professor.
Your philosophical research Orientation.
It was the pragmatism.
What is pragmatism? Cognizant that the one is a professor of philosophy. What was pragmatism? Safina,
Yes, Professor.
in your work, avoid certain phrases like, let us go, which page is that? Page 93. Page 90. Even on your, yeah, there it is there. You said you used pragmatism, and then you go on to subjective ontology and subjectivist epistemology. Remove those things from your work. Do you know what they mean by ontology? Ontology, by the way, is a kind of metaphysics which deals with the study of nature and beings. But of course, we see these things in other people's PhD, and then you just feel, since I'm at a PhD, let me scare these people around. Just limit yourself to pragmatism and take the simplistic definition of pragmatism, that practical outlook. Don't put there those things which may one day put in unnecessary trouble. The other question. Fortunately, in your presentation, you preempted one of my questions. I was going to ask you, how many pre-primary institutions do we have in Chida or in Uganda? But somehow, somewhere, in your presentation, you presented it. So please also put it in your what? In your work. That is very commendable, by the way. And to me, as a supervisor, I get very happy when a student reflects on his work in the post-examination. It means she or he has not been seated since the papers went out. Because some, when they submit for examination, they say, it is over. I only wait for the what? For the defense. That one Now back to, you see, you praise you a little bit, then we strike you. What was your study sample and why? Use so that people hear. Don't give up at the end.
My study sample was 260 participants, and I used the Craig and Morgan 1997 table to come up with that sample.
Now, Safina, have you ever heard of sampling techniques?
To select a sample of a research study.
So back again. Who, let me use now the word, who were your study sample, to be more specific?
My study sample were head teachers.
Number one, number
of the
two.
pre-primary schools, center management committee chairpersons,
number
local police posts within Chira municipality.
Now, Safina, do you realize that that sample is a little bit limited? You denied your study of me asking a question of observer bias. Do you know observer bias? Or participant observer bias? When I was Googling that you work in the very unit of pre-primary. Now, how can you carry out a study on pre-primary without interviewing anyone from that unit? Of course, if you had indicated yourself, I would have asked you a question, how did you control for observer, participant bias? But somehow, how did you miss out this? And why? The other, wait, don't answer. How did you miss out NCDC, which sets what is taught there and what is done? How did you miss out those who made the policy, the integrated policy, those in the Ministry of Education? Did you fear to interview yourself or your colleagues?
Thank you very much, Professor, for that question. Since I'm a student, there was no fear. But since my study limited itself to local communities, it's the reason that I did not come to the national level, but concentrated at the local communities that work closely with the schools.
Yeah, but as I noted, it denied you a key respondent because the local community never incepted that policy. It is the ministry. And this, which is Directorate of Quality, how is it called? Because it is the one to evaluate that what? That policy. You could, in one day or two, get some information and include it so that your work does not become invalid. But that is a matter between you and your supervisors. So how did you analyze your data? There is something I forgot. On your sample selection and the use of the Morgan and Christ table, specify the various numbers and then put it in the appendices. For example, that Chira has more than, say, 5,000 children. So according to this table, selecting only between 10 or so doesn't matter, somehow, like that. So how did you analyze your data? We are about to finish, don't get scared. Process by process. And remember, Pastor Matimba said process by process, but by the time they ended, the girl had become pregnant. How did you analyze your data?
Thank you very much, Professor. When it came to qualitative analysis, I used the thematic codes.
Then the quantitative.
Under the quantitative, I used the test pre-test. And
make sure what you've said, you write it very well. The last question, the methodology. What do you understand by ethical consideration?
Ethical considerations, that is the permission I acquire to allow me do the research. And this includes the letters that give me permission, the feeling of...
Safina, you have to write it properly, what we mean by ethical consideration. Presentation of findings. Chapter 4. Question number 1 in chapter 4. I'll ask you 3 questions. What do you understand by demographic information? Is it the same as the number of respondents?
No.
For you, what did you give?
I gave the number of respondents.
Why didn't you give us the demographic?
I also tried to categorize the gender of the participants that I worked with.
Safina.
But I will
include
add the rest.
clearly the demographic information that is on page, I think, 108, because table 4.1 does not represent that. So you refine it so that you put sex, gender, age, status, level of education, blah, blah, blah. So objective number 1, let me speed up so that you get rid of my ugly face. And this one I'm going to make suggestions. And then I ask a question on each objective. Don't you think it would have been very good to first identify the essence of stimulation activities at school and what they are? Number 2, what are the stimulation materials you found out? You don't need to answer this. What actual school parent engagement on stimulation activities in schools did you find out? And then a conclusion on that. Don't you think that presenting the qualitative and quantitative findings concurrently would have made a better picture because they supplement each other? Objective number 2. I want to spare some time. Objective number 2, analyze. I've already talked about it. Number 3, what school child protection agency did the study find out before even the issue of collaboration child? You don't have an access to this report. Do not bother to write all. Of course, I already talked about, is it only policies which protect children? And I've talked about, as Uganda have a school fire child safety policy, a transport policy, the school food and drink safety policy, not alcohol. You remember, was it in Nakanyonyi or Nabunyonyi where students were poisoned? Do we have a policy in the ministry or no? Protecting our children from expired foods in the school, expired drinks in the school. Do schools check what parents bring to school on visitation day? Because we are preschool still. We have them at school. How often do municipal officials visit to check on the state of infrastructures in the school so that children are not killed by dilapidated toilets? Do those schools have qualified nurses and medical practitioners? And how are the district or Kira, municipal security agencies, IGI, police, DISO, PISO, blah, blah, involved in child protection? And then I conclude on that. From the above questions, don't you realize that at PhD, your idea of school child protection, agents, collaboration, and child protection practice in school is a bit shallow? That you needed to widen it? But you can always make a disclaimer, by the way. Academics are very good. If you don't want to include everything, you make a disclaimer somewhere. My study will limit itself to only policies. And then you close our mouth from any quarrel. Objective number 3, which is the last, to assess the relation between school service providers, collaboration, and healthcare practices. I've already asked you, who are these school service providers? What is government policy on healthcare practices in pre-primary schools? And how does table 4.5 reflect on school health services providers on a whole? I'll leave chapter 4 at that. But I'm going to give you this to guide so that you come up with a better write-up. Discussion, conclusion, and recommendations. It's my opinion, and this one is debatable, that a good rich study discussion should have findings on one objective lumped up. Not as you had discussions on qualitative and a subheading. Discussions on quantitative. Now that one created two seeming studies. Conclusion and recommendation. In summary, what are your conclusions and what recommendations do you offer in lieu to your study objectives? That one you can answer. Objective.
My conclusion is that I bring out partnerships that worked well within the schools to support implementation
Number 2.
of integrated ECC services. Then recommendations.
There are 3 objectives.
Yes.
So I want 3 conclusions. 1 sentence each. And 3
parent-school engagement on stimulation activities. So I brought up the partnerships that work and recommended schools to use them. Then under child protection, there was 1 partnerships that I found on ground, which was mitigation of child abuse partnerships, and I recommend schools to use that. Then under health, there were health care services partnerships that worked so well, which I recommend schools to use.
Safina.
Yes, Professor.
What you have said is very good. Go to your work, summarize it. People don't have time to read a whole page or half page of a conclusion and recommendation. Now I want to end. Today, you've